All right. Okay, so welcome everybody. We have a very full presentation for you today. We are recording it if you do have to jump off, but we did this last year and it was very well received. So we're going to make it an annual thing that we share with everybody, which is we do often get questions of how are you marketing the Medical Society and the products and services? You know, where are we with membership and how does that relate to the marketing? So we have the whole team here with us today to talk about their various areas. We have, I'm just going by my screen here. So we have Lauren Till, who is in charge of our website, web design, web analytics. We have Julie and Mila in the blue room there. Julie is from membership operations and she oversees I'm going to let a few other people in here. She oversees our invoicing that we do to renew our membership. She also works closely with marketing when we do recruitments and getting those invoices out, and also make sure our database is clean and good year-round. We have Mila, who is in charge of writing overall. The dose that comes out every Thursday, hopefully you're reading that every Thursday, that's Mila's baby. And anything really that's written has been written by Mila or come through her office. We have Samantha, who is in charge of marketing. So the creative things you see happening on social media, and other areas as well, but we do focus on social media. Our awards programs, those come through Samantha's area. So we'll go ahead and get started. I'm just going to kick it off. I'm Claire Shearer. I think everybody here knows me. I am the Senior Director for Membership Communications and County Relations. So I oversee the membership operations area, which is Julie's area, membership recruitment and retention, which Julie is part of. Also, Samantha works closely in recruitment and retention. As I was looking over this presentation, I did think, you know, I don't have anywhere where I mentioned Katie and Janet, but they're very important in our recruitment and retention areas. Hopefully most of you know Katie and Janet. If you don't, I would love to introduce you because they are the boots on the ground out in the field. Also the communications team, which Samantha and Mila are part of, and we say that Lauren is our common law wife. She's listed in IT, but she spends a heck of a lot of time with us as well. And also I'm in charge of County Medical Society relations, which overlaps with all of these areas very much. And we provide monthly and quarterly meetings for the county medical societies. Mila oversees a share site for them. Mila and I send probably too many emails, but we do try to keep them updated. It averages out really to about an email a week for the counties. So now I need to make you guys a little smaller on my screen. So just to get started, we are PAMed's marketing and communications are really data driven. And I think that's really important to share because we do get a lot of requests from staff and leaders to say, hey, why aren't you talking about this? Or why can't you do this? Or this is a great idea. We make nearly all, if not all of our decisions based on data. So we are always looking at what are people saying on the website? What are the analytics coming back from the website? If we send an email, how many people opened it? How many people clicked through? We have several contact us forms on the website. What are people asking? What are people telling us about? Social media analytics are very important. What are folks engaged in? We have grown our social media substantially. What are they paying attention to? What is not important to them? Often we do things and we look at the data, we think, if we thought something was going to be fabulous and it really tanked or it went beyond our expectations, we use that data to make decisions on how we're going to move forward in our marketing and communications. So it's also important to know who is PA Med's audience, because that's another thing that we sometimes folks struggle with a little bit. Obviously, physicians are our main audience, physician members and physician non-members, MDs and DOs, medical students as well, and also administrative staff are very important to us. So about 60% of our members come in through group practices and group invoices. So their teams are also very important to us. And often, Julie will tell you, the administrative staff is extremely important in getting those invoices paid, especially as we get to the deadline. We call the administrative teams and we say, hey, can you help us get these paid? And they often do. We also have a hospital medical staff contact membership, and Janet Thompson, one of our field staff, oversees that program. She communicates with them and she visits them, and they are helpful as well in membership, in growing membership and very much in retaining membership. Pennsylvania legislators, bureaucrats, and their staff. Dave Thompson's team, obviously, that is their audience. We do sometimes help in communicating with them. They are paying attention to what we're doing. We tag them often on social media when we're doing something, talking about legislation. Sometimes we thank them if they did something helpful to us. And then Mila is also communicating with the press. So we are doing press releases when important things are happening, and we're also reaching out as experts in various topics. That was very obvious during COVID, also monkeypox, where the press was reaching out to us to say, hey, we don't understand this, we need more information on this, and they came to us as a resource. So as we start to talk about communication, we are often asked about our membership statistics. So these are our membership over time. You see the all members and the full active members. You will often hear me say we are focused on the full active members because honestly, they pay the bills. But all members are important as well. The all members include students, residents, the hospital medical staff, the practice administrators. Those folks are included in the all members numbers there. You see the big drop. It feels like a huge drop from 20,000 to almost 14,000. You may recall that we decided for last year, moving forward, that we would ask our free members to renew. So our students, residents, and we do have a grandfathered category of older physicians who were grandfathered in when we changed our dues categories. We just asked them to tell us who they are and that their information has changed or that it's the same. What we had found was over time, when we were just rolling those folks, we were rolling people that were really a hollow membership. Students, as you know, are very transient. They just simply weren't here, and they had moved on, but we were still showing them as a member, but we had no good information for them. The older physicians, some of them passed away, some of them went to retirement homes, went to smaller homes. They didn't feel the need to tell us because they weren't actively being asked to renew. So what happened was when we asked them to renew, we had a lot of really engaged members actively renewing, especially residents. And that is awesome. And then the ones that dropped off, I really feel for the most part, are folks that have moved out of state, moved on, or in those grandfathered categories, they had just passed away. So we're going to, Julie is with us, and she helps with all of that data, maintaining it, keeping it clean, overseeing the projects that we do to make sure our data is good. And so I'm going to ask Julie just to cover the next couple of slides that review some membership information for you.
Thanks, Claire. So this first slide depicts all of our members. As Claire said, that includes the students, residents, the retired physicians, practice administrators, and the hospital medical staff members. You will see a big increase in our female membership in the ages of 40 and under range. Some of this is due to the fact that there is an obvious increase in females in medicine, but also some of it is due to the good work of our women's physician section. As you look at the older ages, you will see that there's quite a few more males than there are females. Next slide. Thank you. Revenue over time tends to ebb and flow with the state's license renewal cycles as physicians join to take their CME for their licensure renewal. So August of 21 reflects this data and the licensure renewal cycle. And you'll see our revenue again is going to be up for 2023 due to the same fact that the physicians are joining to take their CME and renew their license. You can see here is all of the membership dues categories. We have both paying and non-paying categories, and we like that to share that with you so that you are aware. You will see, again, Claire had mentioned the graph looks quite a bit different than it did last year. And that's again because we asked the students, the residents, and the older physicians that are in the grandfather category to renew. So although we did have quite a few that did not renew, the ones that have renewed, we have found that they have increased a great deal in their engagement with us. Next slide, please. And this is just sharing the breakdown of membership by their specialty. Lots of specialties there. And this chart includes 37,941 physicians in Pennsylvania that we know to have an active license and an address within Pennsylvania. So we consider these physicians recruitable physicians. The membership team actively updates member and non-member data regularly. It is our goal in 2023 to obtain a state license download 3 times. This provides us with any updates and helps us know what physicians are coming into and leaving Pennsylvania. We've also been working closely with a new printer that has a program that has helped us update addresses, and that has significantly helped us and decrease the amount of returned mail that we have received. And you may find it surprising that of all these physicians, just under 70% of them are eligible for our 95 introductory rate. Claire, I'll turn that one back over to you.
Oh, that's right. It has a C next to it. So this is, we've created a PDF that we're going to start sharing with the board every month, just so you can keep track of where membership is. This is part of that PDF that we'll be sharing. This is shows you the overall membership comparisons. I don't know if I mentioned earlier, the membership dues cycle starts actually September 1st. So it's August 31st, We were done with the 2022 membership due cycle. Now we're beginning the 2023 due cycle September 1st, which will go all the way through and end on December 31st. So what we're showing here is all members at the end of the 2020 due cycle, August 31st, was 13,823. The full active members is 7,098. All members to date currently is 7,296, obviously actively renewing and joining, and full active is 4,794, which is actually, the numbers are really great this year. We have in 2022, we had 741 join for our introductory offer, and we have already to date had 1,041 join. So there are lots of folks out there looking to get their CME and also get help with license renewal. We've really stepped up our retention efforts over the last, I'd say, 2 years. And I think we're starting to see the fruits of our labors. We've increased open and conversion rates of renewal emails. We've added ACH capabilities, which is entering your check information from your bank. And we've been very pleased to see lots of new folks using that. We've increased our electronic renewals, which cuts down on the snail mail. That has always been a glitch in my side, that we send lots of snail mail, which is not necessarily, the most efficient or cost-effective route, but it is the route that most of our members respond to for renewal, and for when we want them to really do anything that requires taking action. Historically, they've wanted something in the mail. Thankfully, we're starting to move away from that, and that has been really beneficial to cutting down on our mail really pretty significantly. We've had a lot of people clicking on the renew and also joining online versus calling or doing it through the mail. So that's been great. We've also incentivized folks to auto renew, and you would be amazed at what a t-shirt will do. If you want anybody to do anything, offer them a t-shirt, because they have been coming in droves to sign up for auto renewal for 2024, which is super exciting, because that means they only get one email and one letter from us next year. And then on December 1st, we will simply renew them using the credit card that we have on file. So that is really super exciting. And again, that cuts all of those cut cost and staff time. So we're excited about that. Something else not on the slide, but I want to mention is this year, because of our stepped up efforts, we actually had groups calling us before we ever sent an invoice to say, hey, I want to renew, and I didn't get an invoice yet. And the reason they didn't have an invoice yet is we simply had not sent it yet. And we had quite a few groups say, send me the invoice now. I want to make sure I renew so that my physicians are renewed for the new year. So that was really very exciting. Along with the stepped up retention efforts, we've also had stepped up recruitment efforts. We've got some of the things here that we've done. We've been very targeted in our communications, been trying to be a little more creative, doing some A/B testing. And through those recruitments, we have had over 1,000 physicians join this year already for 2023. So we're really excited about those numbers. And it's important to also note who is not PA-Med's audience. When certain issues come up, some of our leaders, some of our staff say, hey, you need to send this out to hospitals or the public or patients. Sometimes in communicating, especially when we want to move the needle with the public, in regard to the legislature, we will do things, we will do billboards or social media campaigns that are really targeting the public and patients, which is essentially the same thing. But as a general rule, the audience that we discussed earlier is our audience, and not these folks here. So I'm going to move on now for Samantha to highlight some of the different things from her perspective as chief marketer. As I mentioned earlier, she's in charge of social media, marketing, not only membership, but products and services. She's very active with the awards program. So I'm going to ask Samantha to go ahead and cover some of those items.
Thank you. So yeah, like Claire said, a lot of what I do focuses around social media. So I kind of wanted to break down each of our social media pages because looking at it, all of them have increased engagement and following in the last year, which has been really great for us to be able to cost effectively spread the word on PA Med and our programs and things like that. So Facebook is one that we focus on pretty heavily. Since the beginning of 2022, our organic Facebook reach has increased 237%. So organic is not paid. We will do some paid advertising, but that's just like a completely different statistic. This is just people seeing and sharing and engaging with our posts more often. Some of that is attributed to our Doctor's Day campaign, our successes with venue rule and prior authorization, and the awards. As you can see here, the top posts every year are always celebratory. So our top physicians under 40, Doctor's Day, any of our awards always get a lot of engagement. Claire, you could go to the next slide, please. These are just some of the graphics that were shared most widely in the last, I guess, 11 months. Next slide. Another big social media for us, and always has been, is Twitter. So our Twitter followers have increased about 100 this year. So we have 3,267 followers as of the end of October. I actually should have checked this morning. Our impressions over the year have been 91,000, and engagement is people liking, retweeting, commenting, things like that. It's close to 2,000. Some of the things that get shared the most, again, are celebrations and then resources. Med Twitter is a huge thing with the hashtag, so we use that, and resources get shared. And then we also have advocates. Some that come to mind are Dr. Heine, Dr. Pharma. They're always retweeting our stuff and sharing it with their large followers as well. So that's been super helpful for us. Next slide. Again, these are just some of the most shared images on our Twitter this year. Next slide. LinkedIn and Instagram haven't always been the most engaging social for us, but this year that's really increased. Some of the contributing factors to that could be Meta, the owner of Facebook. They purchased Instagram this year, so it's been really easy to cross-post and optimize our posting and our audiences on Facebook and Instagram. Since our Facebook has always done pretty well, our Instagram's doing a lot better. Our organic Instagram reach has increased 547% this year. So that's pretty exciting and really opens up some doors for us. So now on average, our posts are reaching about 7,000 people on Instagram. So you should see, if you follow us on Instagram, we've been using the stories feature more often, doing some more interactive things like polls and things like that. We've also created a medical student specific page, which has been really great for them to kind of have their own outlet for their resources and information. And they we get to be a little bit more engaging and creative with the medical students. And we have to go to where they are. So they really like Instagram. Our LinkedIn has also increased over 200% this year. So, and that's in our engagement and our page views. And we've added about 170 followers to LinkedIn this year. Next slide. Our awards program is not only just successful on social, but just kind of across the board. People really like to celebrate their colleagues and their mentors and things like that. So this year, our Distinguished Service Award, we had 32 nominations, and that's just one person selected out of that. That was Dr. Natalia Ortiz this year. And we get some good press for not only PA Med, but for the awardee and their employer as well, through press releases, the presentation, emails, web articles, social media. We really celebrate this all year round. Truly, we do that with all of the awards, but Distinguished Service, Physician Award for Voluntary Service, and the top physicians under 40. We do a lot around year round. So for the Physician Award for Voluntary Service, that the winner this year was Dr. Patricia Henwood. Again, we did all the press releases and things like that for her. And the top physicians under 40, we had 87 nominations this year, and 40 of those physicians were selected. We were able to do an in-person event for the top physicians under 40 this year that was really well received. It was family friendly, held in Mechanicsburg at PA Med. And there's just some great pictures that you'll see on the next slide. And we got a lot of really great feedback, and we're excited to do that next year and so on with the future groups of top physicians under 40. We're accepting nominations for 2023 awards until January 15th. So please spread the word and nominate people you work with. The more people we nominate, the more people we can recognize and things like that. And we, sorry, I'm losing my words. We also have a monthly, we try to do it monthly, the Everyday Hero Award. This year we did 6. We can recognize as many everyday heroes as we get nominations. So really we need more nominations for that, but that is just an award that recognizes a physician that goes above and beyond the call of duty for their patients or their colleagues. And Katie and Janet get to go out and make a presentation at their practice and do that. So that's pretty great too. Claire, can you go to the next slide?
Yeah, and I just want to add too that these award programs have all resulted in new members and often engaged new members, which helps bring them back from year to year. And also when Katie and Janet are able to go out, they're often meeting leaders within the hospitals and practices because they come out to congratulate their folks that are receiving awards, which then leads to individual meetings with physician or hospital or group leaders, which has been really nice.
Right. So one of the requirements, of course, to win a PA Med award is to be a PA Med member. So as we accept the nominations, then we can reach out and say, hey, you are nominated. You should really join because we're going to get to do all these great things and present you with this recognition if you're a member. So thank you, Claire. The final end of the year cap for the awards is our awards publication. This was kind of born out of not being able to do in-person presentations during the pandemic. However, based off of our engagement on social, how excited people get when they get the awards and get to nominate their peers, and then the engagement on emails and the DOSE articles, we want to keep kind of doing this celebratory year-end wrap-up of all the different awards. And we include our poster contest winners, our innovation grant winners. Last year we had the community care grant recipients. So really we just kind of do a wrap-up of everything good that happened with PA Med over the last year. And it also helps us generate a little bit of non-dues revenue we'll sell advertising placement. So the last 2 years, it's generated about $4,000 in revenue in advertising, and we hope to see that just increase. In 2023, we plan to make the publication physically larger to do a spread on celebrating the 175th anniversary. So we have a lot more space in there as well. Next slide. Kind of piggybacking off of the non-dues revenue, we've really tried to ramp up our partnership and advertising to help generate non-dues revenue. But in addition to that, all of our partners we find will provide valuable education or resources, discounts, things like that to our members. So we're kind of looking at it as additional member benefits for joining the association. As of November 1st, we have 5 annual partners, and their logos are seen at the bottom. These different partnerships generate non-dues revenue through upfront partnerships or revenue sharing agreements. And then we have about 7 potential partnerships in the pipeline that we're working on. So hopefully we really can ramp up this program in 2023. We're also going to have some additional web advertising and dose advertising and awards publication advertising. So the benefits will be seen both financially and through member value as we increase this work. I work with the Business Development Task Force to review all of these and vet all of these partnerships for endorsement. And so if you have any companies that you've worked with, please send them my way, and we'd love to connect with them and see if it's a good fit to benefit the members here. And then the last thing I'm talking about during this presentation is our Be Heard member feedback initiative. So you may have seen these Be Heard logos all over. We use them quite liberally throughout our initiatives and our communications. So the general feedback is if members want to connect with PA Med, connect with a leader, connect with the task force, they'll see that logo and they know they can connect with them there. We've also developed micro communities through the Mighty Networks platform. This is like it's like a Facebook group, but it's really on this platform called Mighty Networks, where it allows physicians and practice administrators who care about a specific issue to get online and connect with others with similar interests and really dive deep. So Be Heard Practice Administrators is just for practice administrators of healthcare practices. They get to ask each other's questions, and they also get information and feedback from our healthcare operations team. They get notifications to their phone, and that's been really great. I know that our year-round Leadership Academy and journal clubs have used them for discussion groups. We also have the resolution feedback for members to provide comments on resolutions referred back to the board. And in April, we launched a member poll where we ask a monthly member question, and members can provide feedback through the dose, our website, and on social. And that's been really great in helping us kind of curate some additional information, qualitative information on our members and where they're at on certain issues like understanding the licensure process or how venue would affect them and things like that. Thank you. I'll hand it over to Mila to talk about kind of how we interact with the press and the dose and things like that.
Hello, thanks, Sam. My name is Mila, and I am the Chief Writer and Media Coordinator for PA Med. Just an overreach, as Sam said, that I am involved in any writing that comes through our communications team, whether it's for the website or for email blasts that we send out, and then also for the awards publication, and then press releases, statements that we send out on our behalf, and any talking points any of our leadership is going to be doing interviews with the media. So those all come through my office, as well as being the contact person for our media. And then I do work with Claire quite extensively on county communications, sending out emails, and when we do our meetings and posting relevant information onto the share site for our counties to be able to access as well. So next slide. As Claire mentioned, the Dose is kind of my baby. It's our weekly newsletter that gets sent to about 9,000 subscribers each Thursday evening, so check your inbox today. It's our one email that we send out that is really focused on news content rather than promotions. I mean, we do promote our member features and things of that, right? But we do really focus on news items that's relevant to our members. This year, our Dose got a new design, and I think it sort of enhances the quality of the emails and allows it to have more of a streamlined readership. And as you can see in our numbers that I have on the slide, I think that has attributed to the high open rate, as well as our click-through rate, our engagement that we've been getting. I think it gives it more of a streamlined look. And you'll see that we had a 7% increase from last year. And so I think that that had a really good, I think that had something to do with it. I think it's easy to read. I think it looks good, and I think people know what to expect now. And it's giving our readers and our subscribers something that they can really go to when they need news items. And our popular, one thing that was interesting is our most popular item article that was shared in the Dose this out of the whole year was about COVID-19 masking guidelines, the updated guidelines that was just released in October. It got 578 unique clicks, and that is huge for us. So that really kind of shows us that our readership is interested in news items that are relevant to them and their practice. So those are kind of things we keep in mind. And something that's not on here that kind of deserves a mention is our resident wrap up, which is like an arm of the Dose. It's our newsletter, monthly newsletter that's sent specifically targeted to our residents. We were kind of getting data. We were looking at our data. We were seeing that our residents audience doesn't want a weekly newsletter. They wanted something that was more monthly, and we send them a monthly newsletter that's mostly like a truncated version of the Dose. We put in the highlighted news items from the month, things they may have missed, things that maybe they should be reminding of, and has showed a substantial decrease in unsubscribe rates for our residents. So that was something that we implemented and is working really well for us as well. Next slide, please. In the press, we've seen an ample amount of news coverage this year. Our largest pickups for the press were mostly on legislative issues such as like prior authorization, venue, pharmacists performing vaccinations, and women's reproductive rights. Our audiences, we send out a lot of press releases and statements on legislative topics, but we also continually to pitch our award nominations, anything with the PAMed leadership that may have, been a positive. So we have different targeted audiences for our press. We have health reporters that we work with on a regular basis. We have regional and local news reporters that we work with as when we send out our award announcements and any changes in PAMed leadership. And then we also work with a lot of state reporters who cover legislative topics, legislative bills that are coming through. They go hand in hand with our health reporters, but sometimes they are separate. So those are our three main groups of press that we talk to on a regular basis. So the one thing for 2023 that we're going to hopefully that we want to focus on, that I want to focus on as a main initiative, is having PAMed be more of an speaking to the press and letting them know that PAMed is a resource for public health issues that have come up, because there are so many that continue to rise, you know, with monkeypox and the baby formula shortage, that we want to make sure that they know that they can come to us, that we can put them in touch with any experts, or if there's something that we can say from our knowledge that helps the public understand what's going on with these health issues. Next slide. Oh, this is a slide I just wanted to show you. One of our highest engagements stories that was run in the Politico, which is a national news source, which was an interview with Dr. Talenti, which was based off of the Women's Reproductive Health Statement that was sent out to the press in September. So that was one of our biggest engagements. It got picked up and it got shared a lot. And then I just wanted to give you an example of other, you know, news items that we've had in the press throughout the year. Next slide. Pennsylvania Newsmakers continues to be an added partnership for PA Med, which reaches audiences in Pennsylvania. We are able to use our partnership to successfully promote different issues as they continue to be important to us. They have a great average of households that tune in every Sunday, mostly on Sundays. I think it varies throughout the Pennsylvania when it airs, but in our area it's Sundays, so that's why I said that. We were on Newsmakers 4 times this year. As you'll see, we promoted Doctor's Day and Dr. Talenti's Servant Leadership Initiative. Dr. Jackson was on about venue rule, which was an important topic at the time when the Supreme Court was really overturning that rule, which they ended up doing, but that was a big issue at the time. Dr. Latronica was on for harm reduction in student service programs, and then Dr. Talenti was also on again, talking about physician burnout and suicide during our Suicide Prevention Week initiative. Next slide. An example of what a streaming of the Newsmakers looks like. One of the other big tools that we use is our public health and HOD alerts. These are emails and text message alerts that subscribers can use to keep up to date. This year, we transitioned our COVID-19 alerts to public health alerts. We heard from our membership with questions on monkeypox, the baby formula shortage, and of course, continued questions about COVID-19. And we thought it made sense to expand COVID-19 alerts into a broader public health alerts, to have a broader reach, to have more, to keep our memberships more up to date on what's going on just in public health in general, so that when they have questions from their patients, of course, they'll know what the latest news is. And our HOD alerts, they continue to be a major source of communication for our members during HOD as it approaches. We use these to drive members to our HOD page on our website so that they can get the latest up-to-date information and be prepared for HOD when it comes. Next slide. Oh, and I will turn it over to Lauren now, who is our web guru, and take it away, Lauren.
I do answer to Web Guru, so I'm okay with that. My name is Lauren Till. I have been with PA Med for 15 years, and I am often on loan. I am in IT and on loan to the communications team because the website is such an integral part of any marketing and communication method. And so it's important that, you know, we are all on the same page and organized moving forward. So next slide. This is one of my dashboards that I use to monitor how the website is doing from a website traffic standpoint. As of about end of October, we are at 1.2 million page views, which is up 25% from the year before. We are also seeing increase in sessions, which is individual users and individual people coming into the website. Now, our specific users are down, but that's not a negative. That is actually showing retention and is showing that instead of people coming once and leaving and a bunch of new people, that we are maintaining them and that they want to come back for more. So we don't view a down of users as a negative as much as it's actually an improvement on our retention efforts. One of the stats that is significant to this year is that we are seeing 5 pages per session, an average of 5 pages per session for users. What that means is that users are coming to the website and not just looking at one thing. They're looking at least 5 different pages before they decide to leave the PA Med website. To web stats, that's huge. That means they're clicking around, they're utilizing our resources. And a lot of that has to do with some of the new tools that we've introduced this year with our resource centers. Much like when COVID came, we created the COVID microsite, and the COVID microsite was a central place of all COVID resources. We expanded on that into our CME and opioid resources. And because we've kind of condensed all of the information into one central place, we've seen a large increase in our pages per session for our users, and the fact that they are staying on the website. The other thing that accounts to that is that they're staying on the website for an average of 4 minutes. Again, in the web statistics world, 4 minutes is a long time. I mean, if you ever sat and waited for 4 minutes on your phone, you probably by that point have done 30 different scrolls on Facebook, 10 different clicks through articles, skimmed a different thing. So the fact that people are staying on our site for 4 minutes just shows the value that the website provides to our membership. And in addition to what Mila does with the dose and what Sam does with social, they're coming and they're staying for a while. Next slide. This is just to show some of our top content. We have CME heavy website, especially this time of year. And our page views is also reflecting upon the dose. If you look at our day of week, Thursdays is the highest day that we see traffic to the website because it is correlated to the dose that goes out every Thursday. So we often see a spike on Thursdays with the web traffic. And we also know that our physician users are looking at it during office hours and during work, as same with administrators, because our Saturdays and Sundays are often extremely quiet. We don't have a lot of weekend traffic with the exception of around the House of Delegates. So that kind of data is important to us on when we push out important materials and when we push out important notices, because why would we push something on a Saturday when we know no one's looking at it on Saturday? You're looking at them Thursday, you're looking on Tuesdays and Wednesdays as well. So we utilize data throughout, we utilize Google Analytics throughout the whole website to tell us the data and to help make decisions for all of our marketing efforts. Next slide. Focusing on our top content, I kind of broke it down into buckets. Our homepage is our biggest driver. And we utilize the homepage as a way to communicate, our top issues, our top important features. It is our way that we get to our members. After that, CME is the next bulk of our content, particularly our child abuse and our opioid CME requirements. We see child abuse as a member-only benefit, and we have opioids, which is open to all. A lot of the times we get people who take the opioids coming back to take child abuse and joining for the additional CME resources and availability that we have to meet their requirements. Our dose articles come out again every Thursday. In 2021, we posted about 200 articles to the website. Already in 2022, we've posted over 400 articles to the website. So we are constantly putting out new information. We're constantly pushing out new information. And I mean, a 200 article difference from 2021 to 2022 is a valuable resource that we are sending out. Right now, we are at about 1.2 million page views for the year, and I am anticipating us to finish at around 1.6 million page views. We find in CME years that we aim around 1.6 million page views. On non-CME years, the website averages about 1 million page views. So CME alone brings in 600,000 page views from every other year, from the even years to the odd years, which is just a large spike that we're used to seeing. But we're continuing to go up in page views from year to year. And it is just showing the growth of the website and all of the marketing efforts that we do. Next slide. So this year, we introduced not one, but 2 new resource centers. We launched the Opioid Resource Center in April, I think, in early spring. And then we launched the Licensure Resource Center, I think around June or July. These are 2 brand new features that we have on the PA Med website. They can be found at /opioid resources and /licensure resources, license resources. As you can see in the screenshots, they have different tabs that group the different topics of content together, much like DO licensing requirements, MD licensing requirements, the PALS software and platform, reactivation, retirement requirements. It is meant to be a self-help place for our members and our physicians to find the answers to their lingering questions. A lot of members call us with all of the issues that they're having with the state and with the state's website, even though it's not ours, it's not our website, it's not our platforms. They call us not only to help answer their questions, but they also call us to call the state and lament their frustrations and help get things fixed. So with that relationship, these resources have become a large part of our year. The CME licensure has only been live for a couple of months and is already over 40,000 page views, which is just huge to see amongst the comparison of all the other things that we do. So COVID is moving into its endemic stage. So we're seeing our COVID resources level out. And as Mila and Sam mentioned, we've rolled that into our public health resources. And we've grown public health to include monkeypox and diabetes and all of the other resources that and information that we're starting to see questions for and getting asked about. So next slide. Now, while CME remains to be the bulk of our web traffic, we continue to strive to make the website a valuable tool for all of our physician members. We have some big plans coming for 2023 with the introduction of the 175th celebration. We'll be rolling out information and have a whole new feature on that on the website starting in the new year, as well as we have some bigger and better resource centers in the plans and in the works to build out those features and tools that everybody seems to be using. So that's me. Move it back to Claire. Next slide.
I think it sounds like it's a good thing you're done. Your voice is going quickly. Just to round out things, we do just sort of want to acknowledge the things that that we face, that we're up against. generally apathy. We are in a world where folks aren't joining organizations. So we are constantly fighting, the onslaught of information and resources that physicians have. Pair that with physician time. I think that's probably in my entire time at PA-Med, physician time has been our biggest challenge. Physicians just don't have time. And when they do have time, they want to spend it with their family, their friends, their, at home with hobbies, what have you. Specialty societies continue to be a competitor, and probably what an old school thing that continues with us is, the business equation is no longer reliant on relationships for referral sources. So just a quick look at a few of the challenges that we face. So that is our presentation. I know we moved quickly through, but we did want to keep you under an hour, and we did, and we have 3 whole minutes to spare. If anybody has any questions, we'd be happy to entertain those. Any discussions, anything you as a board member would like to see from us as far as these resources to help you when you're talking to members or potential members. I do know sometimes we get calls from leaders that say, hey, I was talking to so-and-so at the hospital, and we hear this a lot. PA-Med isn't doing anything about, COVID, opioid resources, prior authorization. And we love those calls because we love to send the resources to the individuals to say, hey, take a look, we definitely are. But always happy to hear from our leadership things that you might need from us. Dr. LePatin, I think it looks like you have your hand up.
Yes, one of the things I want to bring up that is an obstacle to us is misinformation, conspiracy theories, and so forth. People, I see it, I'm very active in grassroots advocacy as well. And some of the things I see that are attributed to PA-Med are just shocking, that I have to fight on social media, and I've done what I can there. But people have ideas. If we promote, just as a for instance, this is not one that happened, but if we promote vaccines, it's because we have a connection with Pfizer and Johnson & Johnson. We're making money off of it. This kind of thing, scope of practice, where we promoted, we're in cahoots to try to get scope of practice liberated, shall we say. There's a whole slew of misinformation. I don't know how to combat it. I try to do it individually on social media, but it's something that we need to be aware of, better ways to spread information, to spread actual information about what we do, what we don't do, positions we hold. It's just, I'm flabbergasted by what I see in terms of what's attributed to PA-Med, and it's disheartening, I have to confess.
One of the things that Samantha is working on for 2023 that will give you some more tools to be sort of a soldier in that fight is, I don't know what we're going to call it, but for lack of better terms, now that the term just went out of my, what's the terms I'm looking for, Samantha? We want to reach out to our members and ambassadors.
Sorry.
Social media ambassadors. So we used to have an ambassador program that honestly we didn't use as well as we should, where we were just sort of on a regular basis sending things out to those folks. And some people shared those, and it did work to a certain extent. What we'd like to do in 2023 is kind of step that up and give people like yourself tools to combat those topics if you so choose, and also to share what we are doing and to have the talking points and the graphics and the different things that you would need to use on social media to carry forth the correct information and the correct statement and work more closely with folks who are active on social media. One of the things that we struggle with is most physicians aren't as brave as you are, Dr. Lopatin, and they are on social media reading and looking at the information, but not necessarily responding or sharing. So we appreciate folks that are willing to do that. And in 2023, you'll see Samantha reaching out to give you some more tools to do that. Was there any more questions or thoughts or anything else?
Just a thank you to everybody for all that you do.
Thank you. Okay, well, we really appreciate that. This team works hard all year to be able to share those awesome numbers and share the improvements that we made. And we appreciate the opportunity to talk to you guys and to take that whole hour. So we will share this with Alexis. She'll put that on board for us. We're also going to share it with our county medical societies. We do get a few requests through the year from leaders within the county medical societies. Again, sort of like, what are you doing? So if you hear that from members, especially leaders within the counties or on our board, we're happy to share this. And also just happy to have a discussion and answer questions one-on-one if that's desired. So again, thank you so much for your time. We really appreciate it. Have a good afternoon.
Thank you, everyone. That was really helpful.